us know that presently there is cholera in Nigeria. One of the things that challenges me is the fact that when we look at this time that we are and the same period last year, the number of cases of cholera that Nigeria has recorded has doubled. The number of deaths has also doubled. So there's a need to keep increasing awareness. And one other thing is that the raining season are coming. I mean, it's just coming. I hope we know that the rain has not come. The rain is just coming because things have changed. And cholera seems to also work with those seasons. There's a way dry season and raining season affect cholera. Now, cholera is an infection of the alimentary canal that manifests with passage of watery stool and sometimes vomiting. Now, we want to suspect that somebody may be having cholera if a person of age 5 and above has moved his or her bowel 3 times or more in a day, and it is just watery. Sometimes we describe the water as rice water stool. In short, you can't see anything than just water. But when it is accompanied by vomiting, we want to suspect that it may be cholera. Now, we know that why we're using the age 5 and above is because in children, there are a lot of other organisms, mostly viral agents, that cause watery stool or loose motion. But once you have somebody above 5 years that is having loose stool 3 times or more within 24 hours, we want to suspect that that may be cholera. And because it's caused by a bacteria called Vibrio cholerae, people may have loose stool due to other things. If somebody having cholera is not managed on time, it can lead to death. What kills people that have cholera is dehydration and electrolyte derangement. So it's important for us to take action on time. Like I was talking about the issue of the seriousness of the problem. As at week 32, which is around August 11, cholera is in 33 states of the country, and it has reached 148 local governments. A total of 5,951 cases have been recorded, as opposed to 2,862 the same time the previous year. And we currently have about 176 deaths, as opposed to 86 the same period last year. For us, Ogun State here, we had our first case in around June 12, coming from the spread from Lagos, from Tiger Nut drink. I hope some of us, got to know that. But after that, it has been brought here. Then we had community spread, apart from those that were due to Tiger Nut drink. So as of 21st of August in Ogun State, cholera has been reported in 11 local governments. We have 20 local governments. So 11 local governments have reported cholera with 48 wards. And we have recorded 128 cases with 4 deaths. Now, what causes cholera? Cholera is acquired when we take or drink or eat food or drink that is contaminated with Vibrio cholerae, which is the organism that causes cholera. Now, how do I interpret this to us? There are some people who carry the cholera bacteria, but they don't have any problem. We call them healthy carriers. Okay? So, through their stool, they can excrete the bacteria. And when someone else come in contact with those bacteria through drinking or eating of contaminated drink or food, they may come down with symptoms of cholera, which manifest early enough as acute watery diarrhea. And then there may be or may not be vomiting. That's why we call it onigbameji, vomiting and stooling at the same time. And cholera is a disease that governments sometimes do not like to admit that they have within their community. Do you know why? Because it exposes their neglect of the community in terms of environmental sanitation, in terms of waste disposal, in terms of clean pipe-borne water. If all of us have good waste disposal system and we have good pipe-borne water to drink from, cholera will not come near us. Now, what happens is that in our communities, a lot of people don't have toilets. A lot of homes don't have toilets. And if you doubt what I've just said, leave your own comfort zone and go to some communities in Abeokuta here, like Lafenwa, like Sabo, like Agoika, and all those places, and those communities that are close to Odogun. So people still, pass their stool on waste dumps and just open defecation. And when there is rain will take this, excreta back into the stream, okay? And some people still go to fetch water from the stream. That's number one. Number two, some of us drink water from shallow wells that are not sanitary well, that are not well constructed. And when there is rainwater, that has the flood that has carried those excreta, it can enter those wells. And that's why when there is flooding, massive flooding in any community, one of the things that the health ministry will try to do is to improve the chlorination of wells, in homes, to avoid people developing such conditions. Now, let me tell us one key thing, which you may be having toilets, you may be having water to drink in your home, but you can still have cholera because you buy food from outside. When your food that you buy from outside is not hygienically prepared, you can also eat food that is, look at those of us who eat from parties, I'm not saying you shouldn't eat from parties, but what we are saying is that those food must be hygienically prepared, and people who prepare food are also supposed to go through some tests from time to time so that we certify them okay to prepare food for people to eat. But what do we do when, to help ourselves? Number one, anybody who has moved bowels 3 times, watery stool, please don't stay at home. Go to the hospital and report yourself. If you are the first person to report, you may be paying for your treatment if they have not diagnosed you as cholera. But if you are the first to report and we did a test and we confirm that it is cholera and the Ministry of Health is notified, we will cover your bills. So nobody should stay at home because of money when you are passing watery stool. Now, in a situation where cholera has been declared as an outbreak like we have in Ogun State now, anybody that is having cholera will be treated free of charge to that patient if you go to government facilities that are managing such cases. Once there is cholera outbreak, we quickly declare some treatment centers that we supply materials to, that our health workers will look after them. Then I want to say that the age-long hand washing is still a saving grace, both for cholera and for all circumstances. Somebody who is a healthy carrier has not done thorough cleaning of his hand after using the toilet. He used it to open the door. You came to that door, you touched the door, you carried the cholera germ, you use it to eat food. Most importantly, we always say that people should wash their hand before eating. But you know what? How many of you wash your hand before eating biscuits? I know you wash your hand before eating eba or before eating amala. But do you remember to wash your hand before eating biscuits? That's why we say that wash your hand regularly. I usually teach something that I call a lesson from the Pharisees. When the Pharisees were taught that whenever they go to market, when they are coming in, what do? They take a bath, because the market is a public place. You have brought all sort of things from that public place to your home. So if also we will try that and we'll put it in practice all the time, that when we go to any public place, we wash our hands regularly with soap and water. So it will save us from a lot of infectious agents that are fecal-orally transmitted, that are transmitted from stool to our mouth, because it's everywhere. Those of us who buy food that are sold on the street, on the road, like buns, like pop-off, like akara, that are not covered, you are also at risk. If I want to buy such thing, what I do is this: give me the one inside the oil, the one that you are still frying. Bring that one and sell that one to me. In that way, no cholera bacteria can survive in that hot oil. So we must ensure that we eat food that we are sure of the preparation. We take drinks that we are sure of the preparation. If you are not sure of the water you are drinking, please boil the water. Boil your water, or add a chlorine solution from water guard. There's a solution being so called water guard. Add water guard to your water. When there is flooding in the community and your well is shallow, please boil the water from that well, or add water guard. So I pray that the Lord will deliver us from preventable diseases like cholera. Now, anybody that reports in the hospital, what the hospital will do is that they will call us in the Ministry of Health and we'll quickly respond. And that's why this time around, we changed our strategy. And that's why the number of deaths was limited to 4. As of the same period last year, we had over 12 deaths. From about 200 cases of cholera, but we have over 12 deaths. But this time we were able to limit the death to just 4. And those 4 were the people that actually never reached the hospital. Some of them died at home, and maybe about 1 died in the hospital. So if you know anybody around you passing watery stool, encourage them. It is free of charge to the patient. Thank you. God bless you.